You've seen it in the news. You may have even seen it in your community. But if you're like thousands of Pennsylvanians, you've also seen it in your very own family. The opioid epidemic has the entire nation gripped in a massive public health crisis that's destroying families, bankrupting communities, and killing thousands. Last year, nearly 60,000 people died from drug overdoses in the United States, and it's now the #1 cause of death for people under the age of 50. And Pennsylvania is 6th in the nation for overdose-related deaths. In fact, more people die from drug overdoses in Pennsylvania than in automobile accidents. More than 4,600 per year. And opioids account for 85% of those deaths. To make matters worse, the numbers are rising dramatically. So today we're going to dive into the reasons behind this crisis, why it's spiraling out of control, and what's being done to try to reverse the trends and reduce opioid addiction in Pennsylvania. We're joined by Dr. John Gallagher, chairman of the Pennsylvania Medical Society's Board of Trustees and chairman of their Opioid Task Force. Dr. Gallagher is a physician specializing in obstetrics and gynecology in Sharon, Pennsylvania. Dr. Gallagher, thanks for joining us.
Good morning, Bob.
So, explain to us the magnitude of the opioid crisis and what it really means for Pennsylvania.
Well, Bob, you've already started with some of the figures, and we can always overwhelm you with numbers. 60,000 people died in the United States last year, 175 a day. That's equal to a plane crash happening every day in the United States, okay? As you said, Pennsylvania ranks 6th in the country. Our death rate is greater than, well above the average throughout the country. It's throughout the state. Every day, 14 Pennsylvanians die. 1 in 4 Pennsylvanians and United States citizens have somebody first-degree contact with either a family member, friend, coworker who has a substance abuse problem. It's a problem that goes across the state. It includes whites, blacks, men, women, young, old, rural and urban areas, all ages across the spectrum. We know that 78% of Pennsylvania counties have rates of opioid deaths higher than the national average. Our Chamber of Commerce are constantly telling us that employers report to them that they can't find employees to fill good-paying jobs because they can't pass their drug tests. So that's why we're working so hard to try and change this.
Now, I'm sure you're aware of some of the criticism, because there are those who say that the overprescription of painkillers has been a leading driver of this problem. So what do you say to that?
Oh, there's blame that goes around, and just no doubt that physicians play a role with this, especially early on. I mean, physicians are trained to help patients. And back in the 1990s, we were told that we weren't treating patients' pain adequately, that we were making people suffer needlessly. So what did we do? Naturally, we responded to try and improve our care and prescribe more. About the same time, we had pharma coming out with new products like OxyContin, which were falsely marketed, as we now know, as less addictive than the older medications that are out there. In addition, we had the organizations and national, like Centers for Medicare Services, coming out and starting to reimburse physicians and hospitals based on satisfaction scores from patients. So if a patient felt their pain was completely taken care of, they'd get lower scores, and everybody would cost more money. And there seemed to be a change that happened in patients. Pain is a part of life. Nobody should suffer from it, but every day, and those of us who get older know this, day in and day out, there's a certain amount of pain that goes with life. But there was an expectation that all pain, even after surgery, had to be stopped. And so patients were more aggressive in their pain medication. So there was enough blame to go around to everybody. What we tried to say is we need to move away from the blame game and say, how can we work together to solve the problem now?
Sadly, the trend lines all seem to be moving in the wrong direction. Cases of drug overdoses are on the rise, deaths related to drug overdose on the rise, and the impact on communities is getting greater and greater. Are we making any progress?
We are. It's slow, and it's definitely hard to measure. Okay? If you look at the statistics, with the implementation of the clinical practice guidelines and training physicians to be more comfortable in prescribing medications correctly, and the use of the prescription drug monitoring programs throughout the country, we've seen a drop in opioid prescribing by about 10 to 20% already. But those numbers are still higher than it was 8 years ago. So we have to correct that even more. Okay? Drug take-back boxes. Okay? Across the country and in Pennsylvania, we've got drug take-back boxes where people can drop off medications, very often in police precincts, but now in drugstores, in college campuses. We work with the Attorney General's office to distribute the doTERRA take-back bags. that would allow patients to take their medications and dispose them correctly. So we're trying to stop the diversion. But what we do know, as the pipeline starts to close down in that direction, some of the patients who are addicted, who don't get their treatment, are going to be looking for cheaper, more available drugs, and that's what will drive them to the heroin and now laced with the fentanyl. So we estimate that probably deaths are going to increase another 30% before we see progress. If you look at the expectations, at the current trends, over the next 10 years, we could lose another 500,000 lives in America before we really solve this problem.
Now, the Pennsylvania Medical Society has launched a program called Opioids for Pain. Tell us about that.
We call it the Be Safe, Be Smart, Be Sure program. And it's a program of posters, flyers, handouts. It's designed for patients to educate them so they understand what medications they're using, are they using opioids or antibiotics, or what are they taking, how to take them correctly, and then how to dispose them properly so that they won't be in the medicine cabinets where children can take them, people coming in the house can take them, and again get diverted to illicit use. Okay. It's a program that we've made available to all of the state legislators to use in their health fairs. We've been giving the police department, schools, any individual organization in Pennsylvania is welcome to this information to hand out in the community, and they can get that from the Medical Society.
So what is it going to take to get our arms around this problem, to wrestle to the ground the opioid problem?
It's going to take a concerted effort of everybody. Okay? Already we have the legislature, physicians working well, but the communities really have to get involved. And one of the things that we have to focus is the community has to start realizing that this is a chronic problem. There's a lot of talk out there about just putting somebody in and detoxing them, which is a great way to go to get started, but that doesn't stop the long-term problem. This is a chronic illness like diabetes, like hypertension, that will take years, not days or months to treat. And we need to change that mindset and the stigma that these people are evil. Nobody starts on these medications to get addicted. They start either because they're having pain, their economics are down, they can't function, this is their release from society. So by working together, changing the economy, getting more jobs, more community support, helping people who are addicted go forward, that's how we can make progress.
How does Pennsylvania compare with other states around the country that are facing this problem?
Well, again, we rank 6th in the country. Okay, our neighboring states, Ohio and West Virginia, are battling back and forth for 1 and 2. Okay, so we're up in that area there too. We have active areas. Many of the communities have action programs, task forces to address this issue. That's working well. Many of our counties have very active programs. Delaware, Philadelphia, Lancaster have groups that meet with legislators, citizens, authorities, physicians, all sorts of groups to try and provide better health care.
Have we discovered a formula yet for public-private partnerships or the medical community working with local law enforcement and other parts of the country to be effective deterrents to this problem?
Teamwork is really the key. Each county in Pennsylvania has a behavioral health commission. And in that behavioral health commission, they usually have one targeted person who's in charge of the drug and alcohol program in that county. And they can work with it's in Mercer County, we're working with ours, and we've developed ways that we're using their ability to get treatment so that when we recognize somebody in the office that comes in with a drug problem, we can immediately get them in touch with somebody that can get them help. Because instead of just saying, well, you have a drug problem, you should take care of it, we can make a phone call, get them to have somebody see them immediately, get them into a program. Because if they get into a program, we know that treatment in the long term will decrease deaths, decrease crime, save lives, and get patients who are being treated to have a productive life. And that's what we want to do going forward.
Well, Dr. John Gallagher, Chairman of the Pennsylvania Medical Society Opioid Task Force, thanks for joining us and for shedding some light on this problem. We've all got our work cut out for us here in Pennsylvania to try to deal with a very, very difficult problem.
Thank you, Bob.
When we come back, we'll dig into state government's war on opioids with Pennsylvania Attorney General Josh Shapiro and President of the Pennsylvania Medical Society, Theodore Christopher. We'll be right back. If you or a loved one are struggling with drug addiction, call 1-800-662-HELP for information about treatment resources in your area. Your call will be completely confidential. This hotline, staffed by trained professionals, is available 24 hours a day, 7 days a week, and is available in both English and Spanish. Call 1-800-662-HELP.